talk a little bit about infections. The thing is that we always get very worried about infections. Like when people get a minor cut, they often rush into my practice and they want a tetanus shot because they're afraid of getting tetanus. It's built into their head that tetanus is nasty, tetanus can kill. And you know how many people die a year in the United States from tetanus? 4. 4 people. Right? That's 4 too many. Absolutely. Get it. I understand. But 4. Meningococcus, very nasty infection. Causes meningitis, blood poisoning. 150. 150. So why am I talking to you about this morning? It's for this reason. We have a vaccine that prevents a viral infection that causes thousands of deaths. Thousands of deaths. Right? Thousands of deaths. I'm not joking. 18,000 women will get preventable, will get cancer from this virus, and 8,000 men will get cancer from the virus. Think about that. And quite a number of those people will go on to die. And we have a vaccine that prevents it. We have a vaccine that works. We have a vaccine that's safe. And we have a vaccine that's been out for years, but people aren't using it. They're afraid of it. We have politicians like Michelle Bachmann saying, if you give this vaccine to your child, to your teen daughter, to your teen son, it will cause mental retardation. Mental retardation? Garbage. Nonsense. We have mainstream people like Katie Couric saying, it'll make you sick. Garbage. Rubbish. They should be ashamed of themselves. So what vaccine am I talking about? The HPV vaccine. HPV causes the second highest rate of death, second only to HIV. Second only to HIV. And we have a vaccine for it, and we're not using it. The rates for tetanus, the rates for meningococcal vaccines are up in the 80-90%, but for HPV, it's down around 40% or less. And why is that? People are afraid. There's all this misinformation out there. And there's association with sex. So people are scared. When they hear sex, like, well, sex, I mean, please. They deserve it then. That's kind of the attitude. And it's crazy. And then some people think that, oh, if I give my daughter this vaccine, she suddenly will become promiscuous. All the things, all the morals I've infused into her will suddenly go because she gets a vaccine. This may sound dumb to you. It certainly sounds dumb to me. So they had to actually do studies to see would that happen. And of course it didn't. It was ridiculous. It's stupid. So, why don't you give it? Why don't you give the vaccine? I once witnessed this and I was really shocked. One of my colleagues, sophisticated physician, she is, very accomplished, I would trust her with my life or your life, was talking to a receptionist, a woman. They were talking about their daughters, and she said, I'm wondering about this HPV vaccine, this Gardella vaccine. Do you think we should give it? Oh, no. No, she doesn't, your daughter doesn't need that. And there was it's like, that's only for those promiscuous people. And you go like, really? Because if your daughter is a virgin getting married, which is very unlikely in the modern world, but even if she is, and her husband has had one previous partner, he can pass the virus to her. She can end up with cervical cancer or throat cancer or whatever. Yes. So that's all it takes. And it's not just for teen girls. It's for boys. Because boys get cancer of the penis, get cancer of the anus, cancer of the mouth. In fact, people like Michael Douglas claim it's because of his sex life that he ended up with throat cancer. So what I'm trying to get at here is that we're now at the phase we understand why some of these cancers are caused. We now know that these cancers are associated with HPV, with a virus. And we have a vaccine. We have a safe vaccine. We have a vaccine that works. So what I'm trying to get at is that you should be vaccinating your teens, your boys and your girls, and preventing this infection. But we've had such a low rate usage of this vaccine over the last 10 years that it's going to cost at least 2,000 of that age group to die from a preventable cancer. That's without all the thousands who will get cancer who are going to go through radiation and chemo and all the rest of it. Now, why would we do that? The vaccine is safe. The vaccine works. The vaccine has been studied up the yin-yang. So I would encourage all you parents listening to me to get your teen daughters, to get your teen sons, get them vaccinated. It will prevent cancer. You will be doing them a big favor. Not only them, you'll be doing your grandchildren a big favor. Because you don't want them in their prime of their life to come down with a cancer they could die from, or end up having radiation and chemo disrupting the family. Do it for your children. Do it for your grandchildren. This vaccine works.